Exercise has been the main treatment strategy for treating Achilles tendinopathy, but is manual therapy just as effective as exercise? A recent study by Stephenson, published in the Orthopedic Journal of Sports Medicine, looked at using pressure massage and eccentric exercise for the treatment of Achilles tendinopathy. In the study, there were 3 different groups. The first group was an Alfredson loading protocol group, which is the staple for eccentric loading for Achilles tendinopathy. In that group, essentially what they would do is that they would lift up both heels and then just slowly lower with the one that's affected, so that way they're just stressing the Achilles tendon and the calf on that side with an eccentric muscle contraction. That group performed those exercises for 12 weeks. That group was only seen once initially to explain the exercises, and then they were also given pamphlets and some exercise videos so that they could know what to do. The second group was the pressure massage group. This group was seen twice per week for the first 6 weeks and then once per week for the next 6 weeks. And the pressure massage was actually performed by using the practitioner's knee to generate enough force into the gastroc and also the soleus muscles. And then the third group was a combined group, and so they did the pressure massage with the practitioner and also the eccentric loading protocol. The outcomes used were a VISA-A outcome assessment, which looks at the function of the Achilles tendon. They also looked at pain pressure threshold, ankle range of motion with the knee bent, which focuses more on the soleus muscle, and then also with the knee straight, which focuses more on the gastrocnemius muscle. And they also looked at the ultrasound to see if there were any structural changes that occurred during the treatments. What they found was that all of the groups, whether it was a pressure massage, exercise, or combined group, all improved significantly over the 24 weeks. They did find a significant difference between exercise and pressure massage at 4 weeks, with the pressure massage group actually recovering a little bit more quickly than the exercise or the combined exercise group. For ankle range of motion, they found that all of the groups improved when the knee was bent, which means that the soleus muscle was involved. When they looked at the knee straight, there wasn't a significant difference between any of the groups or any change from the beginning to the end. The study also found that there was no difference between the pain pressure threshold or ultrasound findings for any of the groups during the 24 weeks. The study concluded that pressure massage is just as effective as exercise when looking at ankle range of motion and then also VISA-A outcome. So what does this study add? Well, manual therapy has taken a lot of heat recently as being a treatment option for a lot of various conditions, but this study actually shows that manual therapy can be just as effective as exercise when looking at function and pain for Achilles tendinopathy. In fact, the study actually showed that the manual therapy group had a quicker recovery in the first 4 weeks than the exercise group. While this study definitely sheds a positive light on the use of manual therapy in the treatment of Achilles tendinopathy, the light might not necessarily be as bright overall. So when we look at the treatment groups, the manual therapy group was seen twice per week for 6 weeks, where the exercise group was only seen once initially to go over the exercises. And so while the manual therapy group improved quicker at 4 weeks compared to the exercise groups, that difference at 12 and 24 weeks was non-existent. All of the groups improved to the same amount. And so clinically, we might only do manual therapy in the first 4 weeks to help capitalize on speeding up the recovery process, but we also want to include exercise to help build the robustness of the system, so of the Achilles tendon and also the calf muscles, using either the Alfredson eccentric protocol or a heavy slow resistance protocol to help strengthen that Achilles tendon. Thank you for watching this episode on the treatment of Achilles tendinopathy using manual therapy. I hope that you found this information useful. If you did, go ahead and give this video a big thumbs up, and if you want to see more of my content, go ahead and click the red button over here to subscribe to my channel.